Hello, Neil. Thank you for joining me. We've got Neil McManus here from the HSE in Ireland. How are you, Neil?
Right, Cale, thanks very much for inviting me.
So can you give us a bit of a background on who you are, what you do, and what your work scope is?
Yeah, so I work for the HSE Health Service Executive. So I work in the Estates Energy Bureau, which was set up in 2018 in partnership with the Sustainability Energy Authority of Ireland. So we have three bureaus covering the east, west, and south regions, and they're resourced with dedicated energy officers, me being one of them, who work with sites to reduce energy usage and progress energy projects. So what we do is, first of all, we look at energy management. So that's embedding best practices into day-to-day activities of the staff. And we look at energy awareness teams. So we also concentrate on behavioural change. Behavioural change can help achieve 5 to 10% energy reductions through behavioural change within buildings. That's just being mindful of how we use energy within our buildings. And we also look at refurbishing buildings, so our existing infrastructure. How do we improve that? All with the goal of which is decarbonisation.
Perfect. Perfect. Thanks so much for that overview there, Neil. Really appreciate that. So you're based in technically a hospital building in Dublin, and I know you work with the health system and these things in health system. So when we're looking at healthcare decarbonisation and how we can make that move along, to reduce the carbon footprint of the healthcare system, which is quite large across the globe, what do you see as the key challenges and opportunities in that and in your work?
It's trying to get people to engage. So that's one of our key challenges, is that we have to understand that we have a health service that's trying to offer the best service it can for its service users. It is coming to the forefront at the moment through a lot of drive from the government, the media, and ourselves. So we're getting our message in there that it's a massive thing, because there is a correlation between environmental damage and disease to people. So we're trying to highlight that. The key challenge is trying to get our staff to engage with us and to train themselves up in what is energy, what is carbon emissions, and how engaging with us we can improve our environments within our workspaces. Other challenges that we face is that we have a deteriorating infrastructure. How do we get these aging buildings to improve their energy use and our emission outputs? We have to look at embodied carbon. We have to look at the circular economy as well. So we're trying to reuse our buildings. We're trying to protect the embodied carbon that's already been generated through constructing the buildings. So how do we get a nice blend there while moving towards our net zero target on 2050 of no emissions being burnt on site?
Yeah, very challenging, very technical topics there, and a lot of moving parts to consider. But I was particularly interested to hear about your challenges with engagement, and I think I would agree that on across the board, maybe health staff aren't as engaged as you would hope for something that is a public health challenge. Climate change is going to really affect health. I was just wondering, do you think there's a role for local action, and do you think that's important in fighting climate change, both on an individual level, but in an organisation level like you work in?
Yeah, it's massive. The change, like a lot of people, we find our staff, they need to know that they have top management support when they engage with us, and also as well on the context of say localization and stuff like that. That's a massive thing as well, because if we're trying to push our staff to become more sustainably aware, so more energy conscious, we need also our local authorities as well to support that. So now, like, one of the challenges that we would have had ourselves and you would have worked with was trying to get proper infrastructure, transport infrastructure, to try and get our staff to our sites in a more sustainable manner, and then trying to protect their transportation when they do get to the site. We've also got to look at our public service options there, coming to the site. We are working on our electrification and EV infrastructure. So that's also something we're going to work on there as well. So we've been all trying to get a fleet, any commercial vehicles that operate within our buildings. We're trying to work with local authorities, and we're trying to develop ourselves so we can. Our fleet is fully electric, so we're producing non-emissions within the city, so to improve air quality.
Yeah, that's really great. And you've touched upon a lot of really great things there. I really appreciate the breadth of things you've talked about there. So thank you for that. I guess when an individual in one of these organizations in a healthcare system identifies that this is an issue they care about, or they've got themselves to a point, they've got stored enough information where they say, I want to do something locally, what can individuals do in their own organizations to help push decarbonisation along?
Yeah, so part of my job is setting up energy teams. So an energy team is a more technically based team that looks at energy consumption. But what we try and do is then we try and develop into what's called a green team. So we start looking at wider topics. So we start looking at waste management, we start looking at water conservation, we start looking at transport. So these then open the door for more people with more ideas on what they want to do to come in. Within these meetings, then we have you could say the knowledge, the access to knowledge, right, through training to get our staff who have these questions and have these ideas, and to get them trained up to give them the strength and the confidence that they need to push these ideas.
Thank you. I really enjoyed that example. I think that's a really great initiative. So just the final thing I wanted to ask you, a healthcare staff is working in a hospital or a healthcare facility, and they're inspired and they want to talk to their manager about what they can do. How should people approach these conversations? What are the general principles that someone should be focusing on when they go to a manager who maybe doesn't have the awareness about these issues that they do, or the enthusiasm? How should they present all of this to them to build support locally?
Yeah, so just in the context of that, the top management, you could say, over the last few years, they were aware of what was coming up the line. So letters have been sent out to all our management to let them know the staff are being encouraged to engage here. So this is where we're going. This is our targets. This is what, as a public service, we're mandated in achieving. Now we've got to get our staff involved. We say to our staff, we say, look, let's just start small. Let's look after our own back gardens, look after our own office spaces at the start. And then from there, we call the ripple effect, where it's nearly a subconscious sort of approach. It just takes one person to stand up and go, look, I want to change the environment, I want to change the culture. And the other people will stand up, follow as after you. But all it takes is one person to stand up and go, look, I want change, But all these initiatives and all this type of actions, they're also supported within the office. Top management are more aware of this now. Staff are more aware of this now, and the resources and the capital are there to support these actions. So it's we're moving in the right direction, Cale.
Absolutely. Yeah, I couldn't agree more. Thank you. Lots of opportunities there, lots of gateways. So thank you for that. I appreciate your insight, Neil, and really love the work you're doing over there. And thanks so much for chatting with us.